Hi, welcome back to Central Line. I'm your host, Dr. Katie Berlin. Different guest than we normally have on this podcast. He comes to us from the human healthcare side, and I'm really excited about that because our guest is David Ballard, and he is helping us out with Veterinary Visionaries, which you probably heard about on the episode with Garth Jordan, AAHA's CEO. This was a passion project of Garth's, but now has grown into something that really belongs to everybody in the profession. And I'm really excited about the momentum and traction we're seeing with Veterinary Visionaries so far. It's May 10th when we're recording this, and so the platform's only been open for a couple of weeks, and we're getting a ton of ideas on there already, and we'll talk some more about that here in a bit. But David Ballard, thank you so much for joining us on Central Line.
My pleasure. Thanks for having me, Katie.
I should say right at the beginning, I have the squeaky chihuahua on my lap. Say hi, Frankie. So if you hear that noise, no worries. But David, would you mind giving us a little bit of an intro to yourself, how you got involved with Veterinary Visionaries, and just sort of what you're up to now?
Sure. So I am a psychologist, but I focus primarily on occupational health psychology issues. I was at the American Psychological Association for 16 years on executive staff, where I was the senior director of their Office of Applied Psychology, their Center for Organizational Excellence, and their Psychologically Healthy Workplace program. So I do tons of work with NIOSH in the CDC, with other groups that are focused on workplace health promotion and wellness, on organizational level interventions that create a healthy, high-performing organization. And I've done work that spans lots of different industries. So I was at APA for 16 years. I relocated from there to Northern Ireland, so I am across the pond. At the end of 2019, settled in January 2020, only for everything to shut down in March of 2020 due to the pandemic. So that's put a big focus on issues around mental health in the workplace for all people in all industries. And in fact, if there's a silver lining, it sort of normalized us talking about those things because it's no longer something that you talk about in secret or you silo off over here. It's something that we've all had to deal with, and not just at an individual level, but for employers, for organizations to do the kinds of things to help support people through not only difficult times like the pandemic, but through normal times. Even as we move forward, all of these issues will still exist and we'll need to continue to address those. So my history has been primarily in healthcare, but spanning other industries. I have a long history of involvement with systems level change efforts to create these healthy, high performing organizations, as well as a lot of experience developing evaluation mechanisms and recognition programs for these kinds of healthy workplace interventions. So when the Veterinary Visionaries Challenge started coming together, Karen Meyer, who's also working on this project, reached out to me. I've worked with Karen in the past on some workplace health promotion and wellbeing programs, and she connected me with Garth. And when I spoke with him, I was thrilled to find out that he was already familiar with some of the large systems change initiatives that are going on in this space, like the new ISO guidelines for psychological health and safety in the workplace, things that are going beyond just telling people to become more resilient and handle their stress better, but actually changing organizations to support that and help people thrive. So I was excited to hear that Garth was already familiar with a lot of that, and he was already thinking big when it came to Veterinary Visionaries. So he and I hit it off, and the rest is history. I've been working on the program to help put this together for the submissions and the evaluations, and just really excited to help support this important effort.
Yeah, we're so excited to have you involved. I think it strengthens the project a lot to have someone like you involved with evaluating the ideas because, I feel like the idea of a psychologically healthy workplace, which we'll talk a little bit more about, obviously, but there are some individuals starting to talk about that a lot in veterinary medicine too, like Phil Richmond and Josh Weissman and Jen Brandt at the AVMA. And these are really, really important conversations because so much of the issues that we have in this field can parallel the challenges that we see in human healthcare and other fields. And we seem like we're a little bit late to that party. The psychologically healthy workplace conversation just took a little bit longer to get started. And I do think you're right. Like COVID really exploded those conversations because suddenly it uncovered a lot of weaknesses in the way that we handle mental health and well-being and the workplace in general. In all professions, but vet med, definitely, I'm seeing that from the inside. So bringing all that experience is so important, and I'm really, really glad you're here. So just one little nutshell summary of Veterinary Visionaries for anyone who missed Garth Jordan's episode. You should definitely go back and check it out because Garth is so passionate about this. And he really shows how much AAHA and other veterinary organizations are interested in having these conversations now. But Veterinary Visionaries is solving platform right now. So it's a place that you can go to submit an idea for helping to solve this big question that we're asking. And the question that we're asking this time is, how might we build systemic solutions and support for veterinary teams to continuously improve mental well-being, especially related to moral distress, ethical trauma, and compassion resilience? And it's a big, big question, obviously, but we have, I think, close to 40 ideas submitted now on the platform. And then what happens is people can vote on these ideas, but the winning ideas will be selected on the how scalable they are, how ready to be implemented, how much of a change they can make in the profession. And they'll be evaluated by a panel, including David and some other pretty well-known members of the veterinary community and some mental health professionals as well. So I'm just really excited to see what comes out of this. And if you're interested in knowing more about Visionaries, you can go to veterinaryvisionaries.org, and we'll put all the information in the show notes as well. So, all right, nutshell over. So, David, now that you've had a little chance to spend some time in the veterinary space, talk to Garth, talk to some other veterinary professionals, I'm interested. This is a big question, but I love this question. What one thing so far from what you know would you want veterinary professionals to know? What would you put on a billboard for us all to see on our way to work in the morning?
That is an interesting question. Well, in addition to a big thank you, I think I would say let the tail wag the dog, play into the veterinary theme here. So I'm imagining, one of those motorized billboards with the big rear end of a dog with the tail actually wagging on it. And I would say let the tail wag the dog. And I don't mean that in a negative sense of, a diversionary or PR stunt to take the focus off of some crisis. But the concept that the smaller parts of a system can create big changes. I grew up and I had a Great Dane German Shepherd mix. And let me tell you, that tail wagged the dog, if nothing else, as well as cleared dining room tables and other things. But those are stories for another time. But I think those smaller parts of a system can create big changes. And we need healthy, thriving veterinary teams to help keep pets healthy, which in turn helps keep families and communities healthy and thriving as well. So even though it might seem like a really huge task to try to change the landscape of veterinary medicine, if people come together, the collective efforts can really make a big difference. I
love that so much. And that, I also want to come back to that later because I think a lot of times we feel like this industry, just like so many others, is being taken over by large corporations, and that that has its benefits for sure. They have so many resources and can create so much change so quickly. But at the same time, there are so many things that we can do on a smaller level to create change, and I don't want us to forget that. It can feel really daunting at times. So I love that. It's a great billboard, and that every veterinary professional would look up at a big billboard with a giant dog butt with a tail wagging. Like, we would all see that. So that's a good idea. You understand us very well already. So, David, how much did you know about the mental health and well-being challenges in veterinary medicine specifically before you started working with us?
Yeah, well, I guess my earliest experiences growing up with pets, dogs primarily, but growing up I had cats and guinea pigs and hamsters and gerbils and ferrets and lizards and snakes and fish. It was
You're one of
pretty much
us.
a zoo. It was a zoo in my house. So, needless to say, we knew the local veterinarian and the people who worked in that practice really, really well. And one of the things that struck me is that veterinarians and their staff, they're cornerstones of communities. They know everybody. They know all the families. They know all the pets. They meet the kids and they watch them grow up and go off to school. And they generally have their finger on the pulse of what's going on in a community, the way they're situated and the fact that they're interacting with everyone. I think it's a real opportunity. So that was my first experience, just kind of getting to know veterinary medicine because I was exposed to it so much growing up. And then later on, in addition to my psychology degree, I did a business degree that focused on healthcare administration. So most of my experience has been working with healthcare organizations, but there are a lot of similar issues that we'll probably touch on later on in this conversation.
So you sort of, although you may not have had firsthand experience with the kind of challenges that we face in veterinary medicine, you could extrapolate pretty well that we would face them based on what you knew about healthcare in general. And that's really nice to hear. I think sometimes we feel like, people outside the profession just think we play with puppies and kittens all day. How could that possibly be hard? But the puppies and kittens come attached to people, which makes everything hard. So
people do make everything hard.
Yeah. So, we hear a lot about self-care these days. And I know Mars did a big study recently that, came up with some sort of big messages from the results that they got. And one of them was, that we need to learn coping techniques to handle stress and the things that we face in vet med. And, self-care is good. And I think there are a lot of different definitions of self-care. But if everyone is struggling, which it seems like these days, it's rare to talk to a veterinary professional in any role who isn't having a hard time. It seems like we need more change at a systemic and organizational level. Do you think, which is scary, do you think that is possible without dramatically restructuring the way we practice?
Yeah, I think this isn't an either or situation. I think it's a both and situation. That, as you mentioned, self-care is important and people need to learn and develop effective coping skills and be able to handle pressures and stress. But it's totally ineffective to put that onus completely on the individual and just say, well, you need to develop healthier coping skills or you need to become more resilient. And as a leader in an organization or as an employer, if you're putting all these resources into, putting armor on people so that they can handle things better, it's not going to be very effective if you put on all that armor over and over and over and you keep throwing people back into the arena to get beaten up over and over again. It's not only is it ineffective, but it's a colossal waste of resources. So from an employer perspective, you're not going to get the results you hoped for, and you're going to waste a ton of money and time and effort and other resources just trying to equip individuals to handle a situation that might be unhealthy to begin with. And there's a great quote from an Indian philosopher named Krishnamurti, who he said, "It's no measure of health to be well adjusted to a profoundly sick society." Let's sink in for a minute. It's no measure of health to be well adjusted to a profoundly sick society. I think the same is true of organizations, that yes, you want people who are well adjusted, who can cope and have the skills to handle things, but is that really healthy if you're trying to get them to do that in a toxic environment, in an unhealthy environment? It's much better to, yes, equip people, but then create an environment that's conducive to those things, that supports it, that takes away unnecessary stressors and hazards and risks that they might face, and help them be able to do that better. That's your role and responsibility as an employer. It cannot possibly just all be put on the individual.
Yeah, that makes a lot of sense. And I don't know, I'm sure that human healthcare professionals are similar because they got into the field because they're caretakers and they want to take care of other people. And a lot of times that comes at the cost of their own well-being, and at least temporarily. And I feel like, vet professionals at least tend to be very type A high achievers, just like many human healthcare professionals, I'm sure are. And we tend to blame ourselves when we don't know how to fix something or feel better. And we just feel like, well, if we were really cut out for this, we should be able to handle this. And so it is important for us to have these coping techniques and, but there's only so much you can do with yoga, and you can't yoga your way out of a bad system or a system that allows you to continue to be injured in these ways. So next question I guess I have is, we do have to do both. We have to take care of ourselves. We have to learn how to do that. We also need to make changes at the higher level. But if we have to pick one to start with, like, does it cascade down? Do we start high level and focus our resources there? Do we start with the individual and work up? Like, how do you see that working best?
Yeah, I actually think you have to work it from both ends, because as we were talking about, the self-care is important, but if someone really needs help, they need more than just self-care. They need more than, like you said, the yoga class or the tips for how to get better sleep or to get more exercise. I mean, we know most of those things that we need to do. The problem is we're in a situation that makes it difficult for us to do those things a lot of times. So I think beyond the self-care aspect, you need to provide professional level supports for people as well. They need to have access to good mental health benefits. They need to have access to a high quality employee assistance program, those types of resources beyond just telling them what they need to do to take care of themselves better. But then I think you have to at the same time address the organizational and job level issues that are contributing to the problem. If there are problems with the way things are done in scheduling or with workload or with conflicts that are happening in the workplace, then you need to be able to identify those hazards and remove those hazards to do things to mitigate the risk that they might be facing at the same time. Otherwise, it's not going to work very well.
Yeah. And of course, that's the hardest answer, right? It's like we have to put resources into everything. But you're right. Like at this point, you just have to scroll Facebook for a few minutes to find solutions for self-care, right? Like help with mindfulness or a free yoga class. There's some, great resources online that don't cost anything that people can really find benefit from, but alone that isn't going to help. But now it seems like if we have to focus resources somewhere, because those are so ubiquitous now, that the resources moving towards a larger scale reformation of how we train, how we accommodate, how we view our teams would be maybe better spent. At least that's how it sounds to me and how it looks to me.
Yeah, absolutely.
Yeah. Are there things in human healthcare that have worked that you think we could potentially adopt in vet med?
Yeah, I think there are a number of things that you can do that kind of span. There are a lot of tactics that can work, but I think it's important to step back and look at the bigger picture and start by creating a well-being strategy or mental health strategy that's linked to the organization's larger strategic and operational priorities. So, you can take examples of programs and benefits and practices and perks and things in a workplace, and each one might have some value and might be beneficial. But there really needs to be a bigger picture strategy, and that needs to be linked to what the organization's doing as a whole. So it's not something that gets shoved to the side, or it's not something that there's no priority on because it's not linked to any business outcomes or business goals. So I think stepping back and creating a bigger strategy, what are the issues? And that starts with doing an assessment, actually understanding what are the hazards, what are the risks, what are the problems people are facing, where are their opportunities to make a difference, what are the needs and preferences of the people who are working there, and use that information to craft a strategy that's going to have a lot better chance of success if you do it in an intentional way, rather than just saying, oh, here's this interesting benefit, here's this great app that we can offer people. Those might all be great, but they need to be tied to a larger strategy that's moving in a certain direction rather than just one-off fragmented efforts.
Veterinary Visionaries is a place. It is not a company.
You could describe it as an ecosystem of people who care and want to help our profession thrive and flourish.
We have a lot of challenges, and many of those challenges we share. So the idea of Veterinary Visionaries is to approach those challenges together.
To co-create solutions and to unify our industry's approach to solving shared challenges.
To offer ideas and collectively solve these issues that our industry is facing.
And do this in a defragmented, inclusive, kind of all under the same tent kind of fashion.
We are so excited to announce the upcoming Veterinary Visionaries Challenge.
And there will be a grand prize of $2,000.
For your big idea on solving mental health issues among vet teams. The Spring Solving event is May 1st through 27th. Join us at veterinaryvisionaries.org.
That makes sense. So you're suggesting that each organization think about that. So whether you're a small practice or a giant corporation, you can sit down. Would you do this with your team or at least with a leadership team? And come up with that
I think
together?
in the most sophisticated cases, when organizations are doing it really well, they're bringing together a cross-functional team of people from the organization who are all at the table. They're all contributing to this because they all have different perspectives and also different takes on the needs that are coming from the different segments of the workforce there. So I think in those more sophisticated approaches, you do have a cross-functional team that's working together to create a strategy. In smaller practices, it might be a key leader or a key small group or just a time-limited work group that gets pulled together to craft that. But I think being able to identify and put down a concrete strategy, link that to what's important to the organization. And if you really want to get leadership buy-in in an organization, especially if it's connected to a larger group of owners or firm, then it has to connect up to the larger goals and strategy and mission of the organization as a whole. So how do all these things you're trying to do, how are they going to affect things like employee satisfaction, employee retention and turnover, performance on the job, engagement with the organization, motivation for people to do their best at work? How's it going to reduce presenteeism? So when people are physically on the job, but they're checked out because they're so stressed and overwhelmed or sick that they can't perform up to their full capacities. Link it to those organizational level outcomes so that what you're doing isn't just a nice thing to do or the right thing to do for people who work there. And of course, it is the right thing to do for people who work there, but it's also smart business, because if you do those things, you're going to set yourself out as an employer of choice. You're going to provide better quality services to the community, and people want to come and stay there, and you'll have the best and the brightest who want to be part of that and doing good things for the pets and for the people in the community.
Yeah, I love that picture that I just had in my head when you were talking about having, a team to talk about this strategy, this plan for well-being for everybody in the organization, and you need representatives from people in every role in that organization to do that. And it does seem like, from my personal experience anyway, that we've often had managers at that table. So I've been in practices where these conversations have happened, but it's been a team of managers all talking, so a medical director and an office manager and a practice manager and an owner. And those people may have the best of intentions, but they don't necessarily know what it's like to be a CSR or a veterinary assistant or an associate vet. I find that associate vets oftentimes get overlooked there because they think that all vets have the same experience. This is just not true. So don't forget about your associate vets. I'm just putting a plug out there from my own experience. Like, if you're doing this, it's wonderful, but don't forget associate vets are not partners or medical directors, and we don't have the same day-to-day experience. But I love that idea, and it must be so empowering too to have people in roles that aren't normally considered leadership roles. I'm making quote marks with my hands because everybody can be a leader, I guess, from within, but that's a whole other conversation. But to have people who wouldn't normally consider themselves leaders in the practice, but to have a role in shaping how everyone is treated and how the experience is for everyone. And I love that idea.
Yeah, and you really do want people from all levels and in all functions within an organization, because they're sitting in a different spot. They see different needs. They have different needs or different preferences. And they might have different ideas about solutions that might be good for that. So too many times these sort of decisions get made from the top and then just handed down to people without a good assessment or evaluation, without any input from people in the various roles. And then it's all just based on assumptions. And it might be with very good intentions, but it's not likely to meet those needs. It's not likely to get good buy-in from people in the organization, in the practice, if they haven't been involved. So that involvement of employees from a range of functions and levels within an organization is really critical. You'll wind up with a better program, better efforts, better ideas, more diverse perspectives that come into the mix. And when you actually start doing something with those, because people have been involved in helping co-create that along the way, they already have some ownership of it. They want to see it succeed. It's not just something that a senior leader from the top is telling you is going to happen now. This is something that you helped create, and so it's a lot more likely to go well.
Yeah, I can totally see that, and have experienced similar, that myself on a smaller scale, obviously, than some of the really big organizations that we're seeing, responsible for a lot of the, clinic ownership and big changes that we're seeing in the industry now. And that kind of leads me into my next question, which is a tough one, I think, because as someone who's worked for a large corporation, knowing a lot of really wonderful people who work for large corporations like Mars, and seeing that we have often maybe expected changes to occur in the industry for the better, for mental health and well-being of our teams at the hands of these organizations. They definitely all are talking about this now. It's a conversation all of the corporations are having, and I love that. But it seems like we haven't seen them coming up with these lasting change mechanisms. There haven't been effective solutions that have made it all better for us. Can't make it perfect, but I feel like things are not getting better in the way that I would hope that they would when people with so many resources and so much human power behind them are having the conversations. So I want to know, in your experience, is this a perception issue? Like, as one associate vet who worked for corporate for 1 year, who's thinking, okay, I'm not seeing change coming out of these big entities. Why not? Is there really that much disconnect between what I feel like they could be doing and what we're actually seeing being done? Or do they really need to do more?
Yeah, I think there's so much variability across different groups, different practices, from excellent to terrible and everything in between. I think one of the challenges, because there's not this unified community sharing ideas and examples and kind of learning from each other and moving it forward more collectively, I think sometimes those good examples get lost in the mix, because there are practices of different types and organizations, different types that are doing things reasonably well. So the challenge is, how do you find those good examples where things are working, even if it's only small pieces that are working well? Maybe it's not the whole program that they're trying to implement that's going well, but there's certain aspects of it that are very successful. How do you identify those and share that learning with others, and then potentially pilot those things in other places so that it can snowball from there? Because it is possible to do it. And I've seen it happen in other industries where there's a similar view that across the board as a whole, the industry is lagging. They're not consistently addressing these issues particularly well. But there are always bright spots within the industry. It just sometimes takes a lot of digging to get to those bright spots and unearth them. I'm hoping through Veterinary Visionaries, I'm hoping we see some examples, not only of suggestions of things that we could do, but examples where there has been a pilot, there has been something tried out that either went brilliantly or it went fairly well, and then they learned some things from it and we can iterate and do better. So I'm hoping some of that learning comes out of it, because with these big organizations and these big practices, they do have the resources to invest and to help share those, where in small practices, in small communities, where those same resources don't exist. And it doesn't mean you can't do those things. You can still be in a small practice or in a rural area, and you can address these issues, because it'll look different than it does in a big organization. But you can get some momentum if there's a significant pool of resources being put in that then can get translated into learning that can be shared with others, and let that take root across the industry more broadly.
That is fantastic. That comes back to our priorities need to be both. They need to be self-care and they need to be organizational and systemic change, right? And what you're saying, it sounds like, is that yes, large entities could be the key to this systemic change across the industry, because they have the resources to really disseminate what's working for certain practices. But we need those pockets, those practices, or those practice groups where they are fostering that psychologically healthy workplace, and they are taking care of their teams, and their teams are seeing results from the systems they've put in place. Those practices we need to put a megaphone in front of them and make sure that everybody can learn from their example. And the big entities have the resources to do that. I really like that. That paints a really good mental picture of just little practices kind of sending up a flare, and then the big corporations being able, or associations like the AVMA, being able to say, hey, everybody look here, this is a really cool thing, let's talk about it, and see if it could work for you. Love that so much. And hopefully that does come out of Veterinary Visionaries.
Yeah, I hope so, because there's a real trade-off between the larger organizations and smaller organizations. I think in larger organizations, they have the advantage of the scale, the resources, even the internal resources to more effectively evaluate the efforts and be able to measure and see if they're getting the results they had hoped for and share, which often in a smaller practice, you don't have those sorts of resources to do that. Now, the challenge is in a larger organization, there's more bureaucracy, there's more hierarchy, there's more red tape to have to cut through to get anything done. And so it complicates things. And you also tend to have to offer a broader range of activities or initiatives, or a bigger menu of things that you're doing, where in a smaller organization, you don't necessarily need to do all of those things. You just need to do the right things. And so in a smaller practice, in a smaller organization, the advantages that they have sometimes is they can do things in a really unique and idiosyncratic way that's a great fit for them. If you tried to put that in a big complex organization, it would be a mess, and they'd never be able to get it done, because there would always be a brick wall to run into.
Yeah.
But in a small practice, you can tailor things to the very unique needs of the people who work there. And so I've seen very small organizations be able to successfully do things with a fraction of the resources, without the whole menu of things, but they identify what are the few things that are really important and that really matter, that we can do well and in a way that's a great fit for the people who work here.
I love that. Yeah. I just had a conversation with a really wonderful practice owner who reached out after he heard the podcast and wanted to share what he and his team have been doing over the past couple of years during COVID. And hopefully you'll be hearing from him on the podcast before too long, because he's offered to come on and talk about it. It was just really, really great to hear about a practice that's taking these steps and that they're working for that team. And I'm hoping that more people will feel empowered to do that. So definitely, if you're listening or watching and you feel like you've been doing some things with your team that are working out well for you, that are creating that environment that you always wanted, and people are feeling safe and psychologically healthy and able to come to management and talk about things and create solutions within your practice, please reach out to me at podcast@aha.org and join Veterinary Visionaries and post your ideas on the idea board. We need you to do that. And you heard David, you could be a beacon that we could all learn from. So don't hesitate to do it. So David, thank you so much. I just want to close. I have one question for you because we've been talking a lot about, having all the voices in the practice heard. All the voices on a veterinary team are important for creating a psychologically healthy workplace. There are a lot of people listening probably who are not in a workplace where they feel like management is going to hear this and just say, okay, we're going to have a big sit down with a committee formed from everybody on the team and talk about how we can make this a safe place. So what if you could pick maybe a couple of things that somebody in any role in the practice, veterinary assistant, a CSR, could start doing regardless of their role to sort of ignite that spark, to have others on the team start thinking about what makes their workplace psychologically healthy? What would those things be?
Yeah, the first thing I would say, and it may sound counterintuitive in that you said it may be in a practice or in an organization where they're feeling like leadership isn't hearing it or they're not open to it. But the first thing I would say is talk about it. Continue to talk about it. And I don't mean just continue to talk about how stressed you are or that you're feeling burned out or you're annoyed with the conflict and incivility on the team. We all know those issues, the compassion fatigue, the moral and ethical challenges that people face on the job. And I think we all know those things, and one of the things that leaders do is they start to tune out, the complainers, or they get framed as the complainers. But that doesn't mean stop talking about those issues, because they're important. But when you talk about it, talk about the organizational characteristics, the way things are structured, the way things function in the organization, in the practice, that are contributing to that, or the things that help offset and help reduce some of those stressors or remove the hazards and the risk that you're facing. So share that kind of feedback about what the organization is doing. If you see ideas of how that could be improved, share that information. Create a work group. Even if the organization is not going to create a work group, if the practice is not going to say, we're going to create this beautiful cross-functional team that's like a perfect setup for it, create an informal employee group to start talking about these issues, to start discussing these issues. And then I'd say, regardless of your level, model the kind of behaviors you want to see. If the issues are incivility in the workplace and there's conflict between people in different roles and people are butting heads, model how to behave civilly towards each other, even if they're differing of opinions or differing goals and objectives in the practice. Model those practices that you want to see. Support each other through all of this, not just, learn to suck it up and be more resilient, but support each other. Be a force for positive change when you all come together. And I'd say, if you have a great idea and it's not being absorbed there in your practice, go beyond your own team. Go out broader into the veterinary ecosystem. Submitting something to the Veterinary Visionaries Challenge, that's one way to do it. But sharing in other forums and with other people who are working in the space, even beyond your particular organization or practice, if it's not being heard there, because there needs to be sort of a sea change and it needs to move in a bigger sense. And when that starts happening, and that starts to become a norm, then those practices who don't do it are going to be the places that are disadvantaged, who won't be able to get the good people who want to work there and who come and commit what they truly see as a calling in many cases, where they want to give back and be engaged in this kind of work. So I'd say keep talking about it, stay engaged, support each other, and talk about solutions, not just the problems that are in the organization. And if you're totally unheard there, take it beyond there, go bigger, go elsewhere, and start making the bigger change system-wide.
Yeah, I love that. That makes me feel like I could go out and fix things, like just listening to you talking about that. And I would encourage anybody, if you're feeling like you're hitting that wall in your practice, if leaving the practice isn't an option, or if you wouldn't for other reasons, do start a conversation with people from other practices. It's so easy to do that now with social media. If you're having trouble figuring out where to go with your ideas, reach out to me. You can always email us at podcast@aha.org. I read all those emails, and I would love to hear about your ideas. And hopefully we could help connect you to some other professionals who are like-minded, because no one should feel like they're alone in this profession. There are so many movers and thinkers and leaders from within who are out there just like you, thinking about these things. So you don't have to feel like you're alone in that, even if you feel like in your organization you're the only one. So please reach out a hand, because there are people who want to take it. David Ballard, thank you so much for all of this. This is such an inspiring conversation, and I really feel like I feel more optimistic now after having talked to you, that it doesn't have to be quite as scary and daunting to create the changes that we need in vet med. There are so many people working towards it. I know we're going to figure it out.
Yep, start small. You don't have to change it all at once. Just keep wagging the dog.
That's right. Keep wagging the dog, and I'm going to make that billboard happen. All right. David Ballard, thank you so much for joining us on Central Line. It's been a pleasure, and we'll see you over at Veterinary Visionaries. We hope all of you listening will come by as well, veterinaryvisionaries.org, or look in the show notes for information on how to get involved. We'd love to see you there. Thanks for listening, and we'll catch you next time.